Number 9, absorb the wisdom of others. And this is we'll be making this available through the Colloquium here. I've got the 1,000. I think I've got most of the 1,000 great books that people need to know about. I've been reading for years and years, obviously. And they're not all healthcare books. I mean, they include books like The Gulag Archipelago, What Bureaucracies Do to People, Bright Shining Lie about the Vietnam War, about how bureaucracies can lead us to untruths, to provide statistics that make people happy as opposed to really exposing things. So these are not all books, but there are some books that people, I think you should all read. Avedis on obedience. This is only a couple of 100 pages long. But anyway, we produce these in the 1,000 great books, 1,000 great articles, and make them available. There's a fantastic book called How to Talk About Books You Haven't Read. By someone called Bayard. And it's partly a sort of tongue-in-cheek, but he says no one will ever read all the books that, checking the time, not the stock exchange, although I could take the stock exchange. No one will ever read all the books, but it's more important to know there was a book by a man called Neil Sheehan about another person called John Vann about how the pressures from the Pentagon led to people manipulating the data and just telling, top of the office wants data, we'll give them data, They want body counts, we'll give them body counts. These happen to people. You need to know about these books. So but it's not possible for people to read everything. And again, we need to think about how we manage the scientific literature and who's responsible in the imaging department for keeping their eyes on the harmful effects of CT literature or the literature about the excessive use of CT. I'm pointing at the head of imaging. I'm terribly sorry, but it makes... comedians always pick people in the audience, don't they? So I said that to Dave Sackett once. I said, I've been so lucky. I've worked with these great people. And I said to Dave Sackett, well, I'm not much use, Dave, of the science. I said, oh, no, he said, it's science and showbiz. Science and showbiz. So learning from great people. And now, of course, with filming and the internet, we can see people, and I've just been interviewed by a young doctor, and we had a discussion about the future. This can go up on YouTube now. We'll get Maureen on video, just 2 minutes, 3 minutes, to spread these ideas to people and learn from people. We've been privileged to see the things we've seen, but we need to share that and learn from the wisdom of others. And finally, and then we'll have time, Maureen and I, for discussion, number 10, become obsessed about sustainability. The greatest threat to health in the 21st century is climate change. The NHS has a carbon footprint of 21.8 million tonnes of carbon. Now, you're a population of 4 million, we're a population of 50 million, so that means I would get with a lot of travel in New Zealand, so I think my estimate is, does anyone know the carbon footprint of the health service in New Zealand? Well, it's probably about 2 million tonnes of carbon. Most of the carbon is not from heating and lighting. As you can see here, 18%, a fifth of the carbon is from staff and patient travel, and 60% of the carbon is from drugs and equipment. The carbon's embedded in the production of these things. So, most of the carbon is generated by clinicians, and rightly so. I mean, there's not much point in doing nothing, but we've developed a model, and this is, I think Jonathan and I are going to take this forward as a theme of Colloquium, is sustainable healthcare. And sustainable clinical practice is, because probably, Geraint, your estates guys are on top of this, the estates people in England are on top of the estates issues, but as I say, the estates are only a small part of it. But there's four features of sustainable clinical practice. And I think Maureen illustrated all of them, actually. One, every clinician involved in prevention. Prevention is the most sustainable type of healthcare. And that means things like liver specialists or A&E specialists getting a little bit involved in the harms of alcohol. Far more impressive if they turn up in their white coats than a public health person like myself giving them statistics. So everyone involved in prevention. Secondly, patient-centered care and the carbon impact of your unit there. We've done that with Reno. Actually, we must tie up on that. We've done work with Reno units where we started things like some of it was recycling water, but the more patients look after themselves, the lower the carbon footprint. Also, the more information we give, and I've been having very good discussions with the Department of Surgery here about patient-centered decision-making, that if you give patients full information, almost always they will use less resources. They will choose less invasive interventions. Thirdly, lean pathways. Lean pathways are all those visits of high value. And again, we are starting to look at ways in which we're using a very good randomized controlled trial underway at the moment of not even using this, it's using the old-fashioned phone for follow-up of bipolar disorder. So instead of someone coming every 3 months, how can you monitor a cyclic disorder on this regular timescale? But the young people are now texting. There's a questionnaire goes to the youngsters every week, and their dose is adjusted when the things start to go off. And the number of visits has dropped dramatically. And then fourthly, low-carbon treatment options. Now this is more difficult, but we do need to work with industry to think of carbon treatment options. Because you see in future, the hospital will have a carbon footprint. So if you want to build a new linear accelerator unit, then it won't be enough just to go and have a march and raise the money. You'll need to have carbon credits. So we're looking at ways, for example, and if you're making choices, say treatment of mild depression, is it going to be drugs or cognitive behavior therapy? Is it going to be face-to-face cognitive behavior therapy or internet-based cognitive behavior therapy? And finally, here's my hero, the Leafcutter Ant. We've tried for the last 50 years to do things by markets or by bureaucracies, and neither of them can tackle complex problems. And ant colonies are complex adaptive systems. One of my heroes in Boston, actually, is Boston's full of people who are wonderful people, like Maureen and Dawn. But E.O. Wilson, professor of zoology, he's written the key book on the ants, £170, so you don't need to get it. But you see, ants work together. The queen ant isn't top of the bureaucracy. Ants are altruistic. You know, they all give a little bit. They give their lives. We're not going to ask you at the moment to give your life for the health service, but who knows? But they give. They're altruistic. They learn. They communicate. So the ants are the model for the future. And I suppose we see, I got excited by the idea of Coatea because I could see it as a potential, as an ant colony. The ants are everywhere. Ants are the most successful species on Earth. If you like a little bit more, although most of this will come through, this is the website for my Better Value Healthcare, the Half My Life. And these are the 10 solutions down the left, and this is the square peg of the 20th century healthcare has to be, it doesn't fit the round hole of the 21st century. So we need to change it. And if you want to see this sort of online learning, you can see that here, but this will come to you through Coatea. But I'd like to finish just coming back to sustainability, and perhaps a thought for Geraint. And I'll ask, I've got a young doctor working with me today, as they always say in The Conjuring, my wonderful young assistant here, my beautiful young assistant will, this is the NHS forest. We've decided to plant 1.2 million trees in England, one for everyone who works in the health service. So I think as part of our sustainability, Jonathan, it would be good to think of Coatea forest, or a forest for healthcare. Climate change is the most important threat facing us, and we can't just leave it to the heating engineers. We have to do something about it. And one thing is to get sustainable clinical practice. The other is to see about offsetting. The forest The forest will offset 10% of NHS carbon in 2040. And I'd finish by saying the most important thing for us to think about is Scrubs here. The young chap who runs Scrubs is, I think, coming later on today. And we're discussing the future. It's not like Mount Everest. The future is something we have to imagine, plan and build. And the last thing I'd say is that in England we are now getting people under the age of 35 selectively involved in designing, planning, building the future, because they're going to have to deal with it. So they might as well get on board now and do it. Thank you very much for asking me.